We're going to move on to our next talk, and speaker is Dr. Martin Krix, who really is an expert in contrast ultrasound. He's probably worked with it longer than Chris and I have. He is currently a medical leader for X-ray and ultrasound for Europe and Asia at Bracco Global Medical and Regulatory Affairs. He has the advantage of being a physicist as well as a radiologist, so and he also holds a professorship at the University of Heidelberg. He's hopefully going to impart some knowledge to us on the safety of contrast-enhanced ultrasound, a retrospective study after over 20 years of use. So thank you very much, Martin.
Yeah, thank you very much, Adrian, for this nice introduction. And just to check, do you see on my screen everything? Okay, yes. So safety of contrast-enhanced ultrasound. Of course, if we talk about safety of contrast-enhanced ultrasound, the key question is, is it safe? And Adrian and all the previous speakers have already that yes, it is safe. And what I would like to do in the following 20 minutes or so is to underline this with some evidence based on really over more than 20 years of use of contrast-enhanced ultrasound. There's a lot of evidence. And I would like to show you, yes, it's safe. You have to take into account some consideration, but otherwise, it's a very safe modality. So, and if you talk about safety of contrast-enhanced ultrasound, you need to talk about the safety of the ultrasound contrast medium. And then you automatically end up in the safety of sonography, as we have already heard before. In most countries in Europe, including the UK, sonography is the only approved contrast agent for radiological indication. And here we talk about radiological indication. And it was first approved in 2001, so more than 20 years ago, and is currently registered in more than 40 countries worldwide. And if we talk about the non-cardiac indications in Europe, we talk about mainly liver lesion characterization, we have heard. It's also approved for breast exams and for assessment of the microvasculature, like the cerebral arteries or peripheral arteries, or EVA, as we have just heard before. And it also has an indication in pediatrics for intravesical use and for detection of vesical ureteral reflux. So these are the approved indications. And we have also heard something about the composition of the ultrasound contrast media. I just focus on some safety aspects here. Contrast media in ultrasound consist of microbubbles, and for sonography, these microbubbles have a quite well-defined diameter of about 1 to 10 micrometers, so similar like red blood cells, so it's a typical blood pool agent. And these microbubbles are filled with an inert gas and stabilized by a shell. And for sonography, the gas is SF6, so sulfur hexafluoride, and the shell consists of phospholipids. A few physical aspects related to safety. Those who are more familiar with using high ultrasound power, that you know that you can even treat tumors with high intensity focused ultrasound. So you can have tremendous biological effects with ultrasound. The question is, how does translate to the use of diagnostic imaging in contrast-enhanced ultrasound, where you, of course, use a much lower acoustic power and low mechanical index ultrasound. And I just would like to refer what is also said in the SPC of sonography, that in animal studies, the use of contrast-enhanced ultrasound has shown some biological adverse reactions. However, these biological effects have not been reported in humans. Nevertheless, it is recommended to use a low mechanical ultrasound also for this safety consideration. But of course, it also has an image quality aspect, as we have heard before. You can make these bubbles oscillate sound, and this oscillation is used for specific contrast-enhanced ultrasound imaging. While if you use a higher mechanical ultrasound, index ultrasound, you can destroy the bubbles, and this has then some effects on the contrast enhancement or its duration. If we talk about biochemical aspects of sonography, we need to look at the compounds of sonography. The active compound are the SF6 microbubbles. active compound is more a pharmaceutical term. You need to define what is your active compound in a drug. So in here it's a gas, but actually this gas is, as we know, it's not active. It's a very inert gas. And you really inject very small volumes of this gas. For instance, 2 ml of Sonovi, it's just 60 microliters of gas. And this gas is exhaled via the lung within minutes. So as you can hear, SF6 concentration in blood within minutes, it's almost zero. Even using a dose which you see here within humans. The other excipients are, of course, belong to the shell, as we know, phospholipids, as seen here, or pantothenic acid. These substances actually undergo the natural metabolism in humans. That means they are metabolized by the liver. And there's another compound called macrogol 4000. This is a polyethylene glycol. Such molecules are used to stabilize microbubbles, and these microbubbles undergo renal elimination. And finally, you have just a solvent, which is simple saline. I mean, if you inject something to a human, you always need to take into account that you can have hypersensitivity reactions. A human can react to everything with an allergic reaction, and this is also true for Sonovi. And also serious hypersensitivity reactions have been observed after Sonovi administration, including also allergies of the excipients, again, for instance, to macrogol, the polyethylene glycol. And that's results in a contraindication, which is quite common to, I would say, more or less also other contrast media or a lot of drugs, is that if you have a patient with a no hypersensitivity to any of the excipients, then this examination is contraindicated. Now, what are the clinical data now after more than 20 years of use? First, of course, there are the Bracco-sponsored trials, which have been conducted to obtain the various indications in different indications. So the database now consists of 58 clinical trials in more than 4,600 patients, which I would say is quite a lot. And of course, undesirable effects were reported. Most of them were non-serious, transient, and resolved spontaneously. So, and the most commonly reported adverse reactions were headache, injection site rejection, nausea. I would say quite typical reactions also for other contrast media. Of note, all these observed effects in the clinical trials were uncommon or rare. That means none of these observed effects had a reporting rate of 1% or even more. And then there are, after more than 20 years, several published clinical studies. I selected some of them, and you all maybe have seen some of them before, shown by Adrian. I just would like to repeat. So I selected those studies with the higher numbers of patients analyzed. So let's say here more than 20,000 patients focusing on abdominal ceus examination. Another study, more than 30,000 patients, including also other indications, and here almost 50,000 patients, including also cardiovascular indications of echocardiography. And first of all, if you look at the events, no deaths were reported at all in these studies. And if you look at the rates here, they are generally very low. It's always a bit difficult to compare different studies because they have different indications, different patient population. They analyze different aspects of adverse events. For instance, serious adverse events is different from severe adverse events, or sometimes they focus just on anaphylactic reactions. Others collected all adverse events. But in general, they are very low. And especially if you look at the serious or severe adverse events, marked here in blue, you can roughly say it's about 1 out of 10 cases you may expect a serious adverse event, which is rare. And finally, here's one recently published studies, which is really a big study. It's more than 460,000 ceus exams coming from China and 24 centers. And again, no death was reported in adverse events in just 157 patients and serious adverse events in 4 patients. So that the authors also here conclude that sulfur hexafluoride microvolts in ultrasound can be safely performed. A few words about pediatric safety. As I mentioned, it's also approved for intravesical injection for detection of vesico-ureteral reflux in Europe. And there's a safety study in a bit more than 1,000 patients, which I would say for children is a quite large number. And in this study, they only observed minor events, no serious adverse events and no death. And if you look at which kind of events were reported, the majority was dysuria, and also the other events were actually, and this is also discussed by the authors, more likely related to the procedure. So you need a catheterization for the intravesical administration, and this is not necessarily related to the administration of the drug. And finally, some post-marketing surveillance data. As you know, each pharmaceutical company collects all adverse events reported worldwide. And for Sonobury, this has recently been published. And all data were analyzed actually from the beginning, so from 2001 until 2023, which means approximately 30 million patients were exposed to Sonobury at that time. So quite a lot of examinations. And in total, 3,182 cases were reported worldwide, which were probably or possibly related to the administration of Sonobury, which means 2.4 out of 10,000 cases. And if you again look at the number of serious adverse events, it's again one out of 10,000 cases, so a number which is quite similar to the numbers I've shown you before. Also, the guidelines we have seen already before, acknowledged guidelines from the Buffenboer EFSUMP I mentioned here. So, and here it's also clearly stated that intravenous ceus is safe and effective. And if you again look at the numbers, for instance, here, serious anaphylactic reactions approximately in 1 out of 10,000 cases. So again, a similar number as before. Of course, one interesting question is always how safe is contrast ultrasound compared to other imaging modalities, especially to CT or MRI, where we give iodinated contrast media or gadolinium-based contrast media. As mentioned before, it's quite difficult to directly compare such safety studies, and especially if you now compare different contrast media, different indication, different patient population, and so on. I just refer here again what the EFSUM guidelines is saying, and also what the American College of Audiology manual on contrast media is stating, so that we can say for iodinated contrast media, allergic-like reactions can be expected in about 0.6%. And severe of them may be 0.04%. And for gadolinium contrast media, the numbers are a bit lower, which I would say is commonly accepted that the rate of adverse events in iodinated contrast media is a bit higher than for gadolinium-based contrast media. And if you compare this with the ultrasound contrast agent, I would say it's roughly comparable with the gadolinium-based contrast media. And so contrast and ultrasound and MRI may have similar allergic-like reactions, while iodinated contrast media have a bit more. And of note, there are also known risk factors for these established contrast media, especially for iodinated contrast media. There are known risk factors. For instance, if you have a patient with an unrelated allergy or asthma, it's a risk factor for allergic-like reactions. And you also need to be careful with patients with renal insufficiency, as we have already heard before. For ultrasound contrast media, this is not the case. So these are really considered to be safe in patients with such underlying diseases, with renal, liver, or also thyroid diseases. And as a consequence, you also need to do any lab test before administration for Sonobury. For instance, you don't need to check the renal function or the thyroid function. Finally, some words about critical ill patients. I mean, this story here maybe started already 10 or even more than 10 years ago, And actually, it was it mainly in echocardiography when there were some deaths reported after use of contrast media in echocardiography. And the question was this caused by the contrast media, or did these patients, or were these patients critically ill? So, and of course, you may have some critically ill patients, so with unstable cardiopulmonary status, but these patients may require an echocardiography simply just to understand, is there myocardial ischemia, is a coronary artery disease? And just because of the underlying disease, these patients may die. And that's why a lot of studies were performed, and I'm referring here to one study recently published also with Soloview, where this was exactly analyzed. So was there a higher risk of patients who got contrast in echocardiography, and this compared to patients who did not get contrast but underwent echocardiography? And if you look at the numbers, actually the numbers in the control group, so without contrast, were higher. So more patients died in this group than in the group which got contrast echocardiography. And then in the end, it was not statistically significant difference. So in essence, there is no additional risk for patients if they get contrast in echocardiography, but these may be critically ill patients, and these patients are in general at risk. Here, another study in stress echocardiography, again comparing unenhanced echocardiography and sonogram-enhanced echocardiography. They observed adverse events when comparable. Of note, no myocardial infarction or death in the sonogram group. So, in summary, if you have a patient, a critically ill patient and unstable cardiopulmonary disease, yes, these patients are at risk, but you may need to have a diagnosis. And then you can give contrast in echocardiography or in contrast in ultrasound in general, but be careful, there's a risk. And of course, it may not be a good option to avoid echocardiography in these patients because sending them directly to cath lab, for instance, has a higher risk for these patients. There are finally some safety recommendations, which are also listed in the Sonogram SPC. And first of all, emergency equipment should be readily available, and your personnel needs to be trained in its use because of these rare cases of serious hypersensitivity reactions. And if you have a patient, you need to know how to treat it. So, then it's recommended to keep patients under close medical supervision at least for 30 minutes because of these hypersensitivity reactions, which I would say is a class label, or if you can find it in more or less all contrast media just because of these hypersensitivity reactions. And you can examine patients with critically ill patients with unstable cardiopulmonary status, but use extreme caution because the risk here is, yes, these patients are at risk. And if you have one of these very rare hypersensitivity reactions, then this can be really life-threatening condition in such patients. This is, of course, not just for echocardiography, but for contrast ultrasound in general. So in conclusion, I think after more than 20 years of use of contrast ultrasound and sonogram, there's a really established good safety profile based on more than 30 million doses administered. A low rate of adverse reaction have been observed in clinical studies, most commonly headache, injection site reaction, nausea, and so on. But a few can be really serious, rarely, as I said, in about 1 out of 10,000 cases. That's why emergency measures should be in place. There's no known renal toxicity, no liver toxicity, and so on. So contrast ultrasound is particularly useful in such patients, and no lab test is required before its administration. And it can be done in critically ill patients, but as I explained, be cautious. So coming back to my first slide, the take-home message is, yes, contrast ultrasound is a really safe method after more than 20 years of use. If you follow the precautions and contraindication as always, and if you need more information, of course, we read the package inside. And with that, thank you very much. for your attention.
Martin, thank you. There's so much data, huge data over 20 years, and I think it's nice to see that it's clearly safer than CT and MR contrast agents. So very, very encouraging to see that. Very safe indeed.